Ganglions are really common lumps that occur in the hand and wrist. A ganglion is made up of thick fluid, like a clear jelly, and it can arise typically in 4 places. The most common place for a ganglion is here on the back of the wrist, but they can also appear here on the front of your wrist, at the base of your finger. Here they're called pearl ganglions because they're like little pearls when we remove them. And you can also get ganglions on the back of your fingers near the nail. We call these ganglions mucus cysts. We're not exactly sure why ganglions happen, but research suggests that ganglions can come from the fluid leaked from a joint, a nearby joint, or a tendon sheath. That's the lining around a tendon. Ganglions are totally benign, which means they're harmless, and they're very common, but they can be bothersome and cause discomfort due to the position that you put your hand in. I'll often see patients who complain of pain at the ganglion when they're bending their wrist backwards, such as when they're doing yoga or in the gym or lifting up off a chair. In terms of treating ganglions, most can be left alone. If you can put up with it, there's nothing that needs to be done. In the olden days, it was recommended to treat a ganglion by bashing it with the Bible, typically a hardback Old Testament, but I wouldn't recommend you do that because you may end up fracturing your wrist. These days, we'll manage ganglions by either injecting them and trying to suck the fluid out, or by removing them. This can be done through keyhole surgery or minimally invasive surgery, where we make a very small incision to remove the lump as a day case procedure, and patients go home the same morning. For this and other conditions of the hand and wrist, I'm available in my clinics in Lancashire, Greater Manchester and Cheshire.